Hello, everyone, and thank you for tuning into Spiritual Wake Up Call. I am on the road, so the background you hear is the sound of a coffee shop. And I love traveling, and I also love doing podcasts. So occasionally those two worlds will meet up. But this week's episode is going to be really special. It's on quantum healing. And I honestly really didn't understand quantum healing. I think that's one of those terms that just gets thrown around and is pretty loosely used. So I wanted to get more into it and really understand what is quantum healing. And I have Michael Harris here to help us learn more about that. So we're going to have a special episode this week getting into the details of what quantum healing is, what it really entails with hard, practical examples of how he used quantum healing to make some leaps and bounds in his spiritual evolution. So let's get ready to open our hearts, open our minds, and see what's inside. Hello, everyone. Thank you for tuning into Spiritual Wake Up Call. Today is a very special episode because I have Michael Harris here, and he is a person that shares something familiar that you may have heard some of our episodes share before, which is he is 33 years sober and has been using yoga as a tool to help in that. But specifically, what we're going to be talking today is the topic of quantum healing. And I have to admit that I am not familiar exactly with what quantum healing is. So I'm going to be learning alongside with y'all. So thank you for coming on, Michael. Welcome.
It's really great to be here, Marilyn. And as I mentioned, as we came on this morning, is I was listening to one of your previous shows, and I just really liked the energy from that conversation. And I really liked the conversation and the willingness for, it was Cold Chance for her to really dig into her story, because I love stories.
I do too. That's what this podcast is all about. So I want to hear about your story. If you want to go further into what brought you into quantum healing.
Okay. Well, let's define quantum healing or quantum leap. There's some different terminology around it. A quantum leap is really a change of state from one state to another. Like when a cell, I think like Dr. Bruce Lipton would say, it's a change from one state to another. And that it's not only a normal process, but it's an expected process in the body as the cells change, and they will change in different ways, really depending upon the environment that you find them in. The environment can be defined as your outer environment. There could be things happening in your outer environment that affect your cells. There are things on your internal physical level that can affect the change in cells. But perhaps most important, at least in my experience, and I'll tell a few stories around that, is really the emotional, mental, spiritual dynamics of what's going on at the moment that can shift the energy of a cell. A cell, one cell, that this is really interesting, or I find it interesting anyway, so I hope the listeners do too. The human body has about 3.75 trillion volts of electricity. 3.75 trillion. Each cell, the membrane of each cell is about 0.7 volts. Okay, so let's put this in perspective for a moment. There have been not quite 2 million Teslas sold so far, 1.9 something, right? A Tesla is about 300 to 400 volts of electricity. So you multiply out the 3.75 volts, the amount of volts that a Tesla uses, and we have about the same amount of electricity in us than 10 million 10 million Teslas.
Wow.
5 times more Teslas than have even been built yet.
So you think
So,
Elon Musk has a number on like plans for harvesting our, no, never mind. We're not talking about that.
well, I mean, I'm thinking that perhaps they can create a seat, a car seat, and because of all the power that we have, we sit in that seat and it moves the car.
That it would be
Right?
exponentially quantum leaping in the field
Yeah.
of engineering of humanity. So,
Yeah.
so.
But even the spinning of the Earth generates more power than the world could ever use. Just the spinning of the Earth, and they can tap into it, but instead we're tapping into oil and natural resources and those type of things. But that's a whole nother episode.
Right.
So I like this topic of quantum healing. Like I said, I wanted to put it a little bit in perspective how much energy we really have in our bodies, right?
Yes.
I've gone through a couple of different things in my life. As a child, I was in a water skiing accident. And as a result of the water skiing accident, I ended up having 60% of my liver removed, broken ribs, collapsed lung, 21 blood transfusions, and I ended up in a coma for about 10 days. And during my coma, I had left my body. And when I left my body, it actually left my body a couple times. I left it during the surgery, and I was standing there, and it was really interesting. And in hindsight over the years, because it's been 50 years since it happened, 51 years since that happened. But I was standing looking over my body with a guy named Fred, and he had blue jeans and a red plaid shirt on. And he's still with me all the time. He's one of my spirit guides.
Right.
And I thought, well, why doesn't this guy have some weird name I can't understand, or, something, or has some robes or something? But he came to me in the way that I could understand him. Right.
Exactly.
Right. And so I left my body, but there were some robed spirits, I call them. The robed spirits were there. And I don't remember everything that happened, but I do remember coming back to my body and reaching out and saying, I'm not ready to go yet. Right. So here these spirits are, and I'm saying, I'm not ready to go yet. And they're, telling me back, they says, you're not through yet. It's time to go back. And I'm reaching out with my hand, wanting to stay. The next thing I know, I'm back in my body and I'm waking up for the first time in 10 days.
Wow.
Here it is. It's 1971. I'm not expected to live. I had a 20-hour surgery. I mean, it was one of those events. I don't know the way it is now, but at least at the time, I was the youngest person to have had that much of their liver removed and survive.
That's amazing.
Yeah.
That's amazing.
So again, and that's only my first big health thing. I had another one later on, but I really, again, we can go down lots of rabbit holes here, but I really developed a resentment towards God. I mean, the feeling of being where I was in the garden outside of my body was loving and warm, and I didn't want to come back. I wanted to stay there. So I realized that, especially over the following next couple of years as I become a teenager, I'm really angry that I'm back because I wanted to stay. Where some people have an out-of-body experience and they will, just feel total love from then on in their life, right? They'll have a different experience. My experience was one of anger and resentment. And to make a longer story shorter, to really talk more about the quantum thing, but I really jumped into drinking. My self-esteem was really low. I didn't think I was very worthy. My body had been pretty damaged. I'd been a pretty active kid, and so I went from that to having a tube in the side of me for 6 months to, a drainage tube and all that stuff. And my life had, turned upside down. My parents were happy that I was still alive, but I didn't feel like I was healing, right? I didn't feel
Right.
like I was emotionally healing. And I went to them, I said, I think I need some more help. And they were just happy that their little kid was alive.
Right.
So, as I keep diving deeper into drinking and smoking pot and a few other substances from time to time, I was suppressing that anger that I had, and I was feeling more powerful than what I may have been, right? So I started getting into trouble at times. I got a couple of DUIs, which is another quantum healing experience. And if I can get to it, I will in our time. In 1986, I ended up again in the hospital. In the way that I ended up there, I had started developing a lot of pain in walking, and I didn't know what it was from. And I ended up at OHSU in the vascular department having an examination, and they said my right leg was 100% blocked, my popliteal artery, and my left leg was 65% blocked. And the doctor, when the nurse started doing the examination, she didn't even get into it. She just called the doctor and had the doctor come because of the condition of my condition.
Right.
And he looked at me and he says, we might have to take your leg. And I said, F you, you're not taking my leg. Just like,
Right.
F you, right? I was a little bit more verbal than that, but that gives.
Great. No, I don't know if you know, but I'm a nurse. I work in the hospital. So I know, I've seen that.
Yeah. So I ended up having a fempop,
Yeah.
and here I am, 27 years old, having a 80-year-old disease. It's a kid.
Yeah. Yeah.
Right?
That is
Still in my 20s.
very early on to have that.
Yeah. My blood panels were all normal. Cholesterol was 140, LDL, all those things, HDL, homocysteine, were all in the normal range, what they consider to be normal. Yet I was presenting with, the blocked arteries, with authorized plaque in my arteries. Well, a couple months later, they did a couple of fempops, one on each leg, and then they wanted to do more. And I said, no. And here I am at OHSU, the vascular department, the assistant professor of surgery are there saying, if you don't do this, first we're going to take your legs and then you're going to be dead within 6 months. And I said, no. I mean, my stubborn part came out. I went, no, we're not going to have surgery. And no, that's not going to happen. And at that point, I didn't know anything about really anything. And I got up, they wheeled me to the door in the wheelchair, and I got up with my cane and started walking. And I couldn't walk very far.
Yeah.
And I didn't know what I was going to do. I had no idea where I was going to end up.
Mm-hmm.
And this is where one of the quantum healing events, I'll mention it as we get into this a little bit. And I think that quantum healing and quantum leaps are natural events, but we look at it as something that's unusual or miraculous, and they may be a miraculous change our perspective of them, but I think that it's just part of nature. It's the way that nature heals itself. And so I end up in a place called the Pritikin Longevity Center in 1987. It's in Santa Monica. It's not there anymore, at the end of Ocean and Pico, right on the boardwalk on Santa Monica. Nice. And where the professors at OHSU were saying, when you're walking, if it hurts, stop. Now, I was talking to the doctor down there, And he said, when it hurts, keep walking. So he gave me this idea, and I said, well, what do you mean? He says, well, when you walk, you start to build new blood vessels. You start to build new collateral blood vessels. You start to move your blood. You're moving your energy. And the only way to trigger that process is to walk into the pain. You can't do it sitting on the couch. You have to move your body.
Yep.
So, here I am now, 28. I'm on the sunny beach of Santa Monica, or next to the beach in this the longevity center there. And I go out on the boardwalk, and I don't want to feel like I'm the 97-pound weakling, right? And there's lots of women on the rollerblades going up and down, and I'm not going to sit there and look like the sickly kid. I'd done that, been there, done that, And so I started walking. I would walk and my legs would hurt and pain. And then all of a sudden things began to shift. So within 2 weeks, I went from walking about 10 feet, literally walking 10 feet with a cane and holding the wall, to walking 2 miles unassisted within 2 weeks.
Wow.
So, again, coming back to Dr. Bruce Lipton, which was a cellular biologist, he still is, that did a lot of research around some of the early cellular research, and went from thinking, because medicine used to say, well, your genes are what they are and there's nothing you can do to change them. And Dr. Lipton, Bruce, he would say, well, no, not really. There's this environment, and if you change the environment, will change what the genes are, how they're expressing themselves.
Yeah, I'm familiar with his theories on epigenetics, and it's amazing. Yeah, his work is amazing. I'm going to make sure to go ahead and put a link to it, because we're talking about it and it just discusses so much. But I want to go in and ask you something about this quantum leap, just about your story and the relationship to pain. Now, I'm a nurse and I work in the hospital, and you can understand that I also have this resistance to the industrial medical complex. I'm trying to change the system from the inside out, and I'm realizing that that's really not going to happen. I'm going to have to go out and eventually, when the time's right, and do it from the outside. But it's hard at being just a nurse and saying, no, you do need to walk, when you know that there's all these understandings that of what you were saying, like moving, instead of saying stop moving, like the doctor saying stop moving when it hurts. And I know that like they need to push themselves. That's really hard for me, because I really don't have the power in the say of it. I can explain to them, but they're always going to trust the doctor 9 times out of 10. And so especially in American culture, we have such resistance to pain. It's the evil, bad thing we want to run away from. But what I hear you saying is that you worked through the pain and made that quantum leap. Now, would you say that if you didn't have the pain, and if you didn't have even like the pain, or even like your road to recovery of being in substance use, was that part of the quantum leap, or could you have done it without the pain, without the addiction? Would that be able to have happened?
That's a big question. I will tell you that, again, we can get into the history of pain for the last 100 years, because it's fascinating. Like in recovery as well from addiction, it's almost 99.9999999% of the people that decide to get into recovery, to get sober, is a result of overwhelming emotional pain.
Yes.
Out, right?
You're right.
It just is. Maybe it's probably 100%. And I know when I had enough, and I'd gone out for, one more night. I'd been sober for 23 months. I won't get into the whole story, but I drank for the night. And I ended up back in the hospital again, and I had some liver damage and some things that were going on. And I had somebody come to me and he said, "Are you ready yet?" You know, and I had hit rock bottom. This anger that I had towards God, you know, was the only place left to go, was higher power, you know, the universal power, however somebody wants to define it. I had no other place to go. So from that pain that I had and that recognition that it was over, I had to turn it over, so to speak. And instantly, I mean, I can still feel the swoosh in my body. You know, this is December 1988. I felt like this swooshing feeling in my body, like everything had changed. Again, I define that moment as one of the most significant quantum leaps, so to speak, or quantum healing experiences, because from that moment, all my desire to drink or to use or anything else was gone. And I was now allowing the universe, the God energy, to come through and to take over again. So another quantum leap type of experience. You know, again, I felt it in my body. And we know it when we feel it. This is kind of on the another end of the spectrum. Have you ever blushed?
Oh, yeah.
I consider blushing a quantum leap, because you're going from one state to another instantly, and you're bringing this blood to your cheeks and you're turning red, and you know what, however it may be manifest, but it's an instant change of state.
So it doesn't have to be painful all the time.
Doesn't have to. Quantum leaps don't have to be painful. No.
Okay. But often it seems that they are the most profound ones and that are life-changing, seem to involve pain, a certain amount of pain, a lot of pain. And the ones that in my life, it has been a part of my process as well. Like you said, the pain became the pain and the emotional pain of what the addiction was causing became higher than the pain that I was trying to cover up. So it was like, I can't, I'm going to have to do something about this. And so the spirit learns so much from that experience of the pain, and learns so much about the experience of the exaltation of coming out of that lower part of your existence where you're always in pain, and you're just like, you know what, I'm done with this. And then you realize there's more to life than what you've been doing.
Yeah. And you know, that phrase that, you know, Bikram said to me, you know, when I look at it, you know, like in yoga, you know, my most significant lesson in yoga wasn't how to do a better head to knee or how to do standing bow or anything else. It was, don't worry about it, forget about it, just do the yoga. That has been my biggest lesson. And that's where quantum leaps have come from.
Right.
Because once we release that energy, again, so much more will be revealed, and the energy will help shift, and healing can begin to happen.
Yes, absolutely. Do you have any other, like we talked about Bruce Lipton, but do you have any other books or resources that you'd like to share and talk about?
Well, I'm a huge fan. I don't know if you or your listeners have heard of Dr. John Sarno. Have you ever heard of John Sarno?
No, I haven't.
He was head of clinical rehabilitation at NYU Medical Center, and did a lot of back stuff, a lot of back surgery. And in the early 70s, he realized that most of it was worthless, that they would do these surgeries and 6 months later, somebody would still have pain in the same place. And he says, if we're so good at these back surgeries, then why is the pain still present?
Right.
You know, why did it come back, right? L5, S1, you know, all those, you know, different spinal surgeries and injuries that they would have. And so he started writing a number of books, and he was the first one. He wrote a book. His first one was called Healing Back Pain. And so I actually started diving that into the 90s, because I had had a lot of back pain as well, and started realizing what he was saying. And I later asked Bikram and his wife at the time, Rajashri, I said, what is this stuff about Dr. John Sarno and, all this stuff, and it says it's all yoga. And John Sarno was saying essentially the same thing when he was alive. Don't worry about it, forget about it, just live your life.
Right.
Surrounding physical pain. And so he ended up writing a number of books. This was one of them. This is one of my favorite books. It's called The Divided Mind.
Okay.
And it's really about mind-body disorders and really dives into it. And then I met about 10 years ago a guy named Dr. David Clark, and he was a gastroenterologist by training out of Stanford, and he ended up as one of the professors of gastro up at OHSU and associate professor of ethics. And he started discovering, he discovered early on through the gastro work that much of the manifestation of the symptoms that his patients had were not the result of something physical. It was something in their mind. And he started exploring that, and he started realizing that he could help people make these shifts in healing. One example he likes to talk about is this woman, 20 years of in and out of the hospital, a couple dozen times and different surgeries and all of this. And he dived in, and within 20 minutes realized that it had to do with her relationship with her mother, and she was, having gut-wrenching pain as a result of that. And within that 20-minute time, this woman was able to heal, never having gastro issues again.
Wow.
Right? So, my point is that much of our perceptions of what we believe is true may not be.
Right.
There's another great book, and this is called The Great Pain Deception.
Okay.
It's a fascinating story of this guy. Again, started out with his wife and him having substantial issues, particularly his wife, and through some issues of giving birth and her spine, and ended up being in a wheelchair.
Wow.
And all of this stuff, and him diving into his understanding of pain and going, oh my God, there is a different way of looking at this. And 100 years ago they looked at it differently than what they do now. A lot of the pain stuff, they use drugs, they do like L5S1, and I don't remember the name of all the surgeries, but they'll go in there and literally they'll numb the nerve, right?
Mm-hmm.
Kind of kill that nerve connection. It doesn't do anything with the underlying issue, but it stops the pain from coming out at that point. But then a year later, it might come out in your shoulder. Yeah, it might come out in your shoulder.
Exactly.
It might come out in your hip because it's finding a way to express itself.
Absolutely. Yeah, pain is a messenger that we try to ignore most of the time, but it usually is giving some sort of message. And there's a big difference between being pain-free and healing.
Yes, and there's the difference between pain management and the curing of pain.
Yeah. Yes.
Sarno said you can get rid of the pain. Dr. David Clark says you can get rid of the pain. There's a website, The Cure for Chronic Pain. Nicole Sachs, she's a clinical social worker that used to work under Sarno, that worked, with a lot of the Sarno patients. And so she has this thing, and I think the website is you open it, says The Cure for Chronic Pain. We don't need to suffer at the level that we're suffering. Sarno went to the Senate. He testified in the Senate hearings, about, all the medical, all the drugs and all these other things. And some of the senators had used his techniques to heal their bodies. Yet in medicine today, the primary focus is still that medical intervention of drugs and surgery.
Yeah. Right. I do breath work, which is a somatic style where we have to get into the body, and we don't spend a lot of time in the mental fields, but we spend a lot of time actually in the physical sense, connecting that to what is going on emotionally and spiritually. And part of it is, well, a big part of it is them being able to, the clients being able to feel what is happening. And there's this amazing story of my mentor, Stephen Jaggers, who was doing a session with a woman who was having a huge problem. Like most people are laying down and getting dropped in and getting into a meditative state when they're breathing. But this woman was just had eyes, deer in headlight look, and just wouldn't participate, but she wanted to be there, but she was very anxious. And he comes to find out that this woman was a pain specialist doctor. So if anybody knows what those doctors do, they specialize in numbing people. They specialize in, just as what you were talking about, the epidurals and the different ways of managing pain and of numbing people. And what this special modality does is we get people into their body and to feel so that they can heal and cure the pain. Because, and that's a quantum leap in itself, but it was very hard for her because she spent her whole career, her life, her living was made on numbing people. And here were all these people feeling so deeply what had been just a deep rooted problem in their lives, created from so much emotional pain or whatever they came here for. And they're crying, they're screaming, they're angry. And she had to sit there and listen to it all. And it was so uncomfortable for her. But at the end of it, she got into it a little bit, and she shared that story with everyone of how much that was a quantum leap for her to just be around people that were feeling. Oh, it's interesting.
There's an organization called the PPDA, the Psychophysiological Disorders Association. And it's actually ppdassociation.org, and it's Dr. Clark's organization. He's in Portland. It's his mission is helping to change the diagnostic system in our country, because it's basically based on a physical diagnosis, right?
Right.
So he's going around into different places and helping to teach a new way to diagnose the clients, the patients, in a way that incorporates the mind and the body, the psychophysiological interaction that's playing, that interplay, to help recognize these things. And like the woman you said that was in pain, what is really causing that pain? It's not just, oh, you hurt here, so let's numb that. Okay, you hurt here because something is happening up here, and it's a natural process. It is not it's natural. Every human being experiences. It's the nature of who we are. It comes up. It comes up out of the unconscious, subconscious, and it manifests itself as pain in our body. That's just nature, right?
Right.
And I can describe nature events with that too, but as that expresses itself, again, like this woman that I hear you talking about, having this shift, this quantum shift in her thinking, is just like, oh, whoa. And then we're able to heal people. And I heard you say a little while ago too about being a nurse and the doctors, the patients listen to the doctors. I suspect, though, that when you're working with people, you're probably an angel to them. Right? And
well, I try to be. I don't go around saying that too much.
Well, no, probably not.
In my actions, I try to be.
Yeah, I'm sure you are. But if somebody wants to find out more, they go to the PPDA. And there's a whole directory of physicians all over the country. And many of those physicians had a similar experience as what I heard you with this woman. Here's a doctor, they're doing their practice, pretty conventional. they have some type of event, a pain event or some other type of health event, and nothing is working. They come across these ideas and bam, it changes their outcome. It changes, they're able to heal, and then it changes their practice.
Yeah. Yeah, there's so many different levels that you can go through to get to the root cause, because like I remember if I had, like, for instance, I once had numbness in my hand, it was like tingling, and I traced it down to, it was back when I was drinking heavily, traced it down to when I basically got drunk and fell down the stairs, which I'm laughing about it now, but it really wasn't funny. If you think about it, because I was hurting myself. And I went to a chiropractor because I knew that it was something that had to do with rooted and my fall, where my hips and my spine were, and they were actually able to heal it. Like I was able to get the feeling back just from that root. So it shows that there is that level of physical healing, and you go to like where the nerves are connected at the vertebrae and all that. But even the more rooted healing is the emotional, spiritual part that was unhealed, was me exhibiting this behavior of getting drunk and hurting myself. So, you can go so deep. There's so many layers. Like, why was I doing that? Like, I always like to ask, why are you hurt? Why is this happening? Like, keep asking why, and you will get to the root of the problem, and then you can get to how.
Yeah.
So,
yeah. Well, and it's interesting. What they've also found too is some of the more traumatic type events, like the fall, that going into the emotions behind it is really important. And Sarno also said in many cases you don't have to do that, but you have to be aware that the process is happening. So like if I experience pain, because we all experience pain, if I feel like a little pain in my knee or something, gazoon tight, a quantum leap with that. I can't hear you. Can you hear me?
Well, I put it on mute while I sneezed, so nobody had to hear, but thank you for
I didn't see the mute. Okay.
Thank you for the blessing.
So what was I saying now?
You were talking about
sometimes, like Sarno would say, like if I get like a knee twinge in my knee or something, I'll just say, hey, I wonder what's going on underneath. Why don't we just let go of that pain? Just like that. That simple. And it will just like go away. I'll forget about it. Don't worry about it, forget about it.
Right.
Don't worry about it, forget about it, just do the yoga. Don't worry about it, just keep walking. Don't worry about it, forget about it, go climb a mountain. Don't worry about it, forget about it, go have dinner. Whatever. Right?
Amazing work, Michael. I just want to commend you for going through all that you have gone through and shared with us. It's amazing. You're a powerful healer, self-healer, and sharing your stories is helping others as well in the process. I would like to ask if there's anything else you'd like to share before we sign off here. And I appreciate your time so much, but we've learned so much already.
One of the things that I want to mention, and I have a real passion for this right now, is what we're doing right now. I believe that stories heal. And since the beginning of time, we've been sitting around campfires telling stories, about our life and about who we are, and that continues to happen today. And we find out through other people's experience and through speaking our own experience, how we can heal, how we can have a better life, right? People that are in recovery, a lot of recovery is based around people talking about their story with each other, in different ways. And that in today's world, oftentimes, depending upon where you live and what country you live in, many stories are being suppressed and you're not even allowed to speak about something. And so I think it's even more important than ever to get out and speak. I think it's my responsibility in the world right now to get out and not only speak my story, but help other people tell their stories, to be on podcasts like what you're doing right now. You're bringing all these people in, you know, and some of the different guests, you know, that at least that I've listened to, like Colleen and Cole and some of the different guests, is helping to spread stories of really life and healing. And it's really a spiritual journey. I mean, that's what this show is about, is a spiritual journey. And
Yeah.
I think that the more that we're willing to tell our story, help other people tell their stories, listen to each other's stories, I think the closer that we're going to be able to come, and really, you know, the more loving we can become. And we need that in the world right now. There's a lot of energy in our universe, or in our atmosphere, in the universe too. I invite anybody that's listening today is, you know, find something that works for you. Start journaling every day, do some breath work, go to yoga, take a walk, you know, and, you know, being kind is more important than being right. You know, allowing that kindness to come up, and, you know, try to have the best life that you possibly can. Even if we only help one other person have a better life, that's huge.
Right. Sharing your story. You heard it, folks. It's going to help heal the planet. Thank you for sharing your story, Michael. I really appreciate your time.
Absolutely.